To a new study. Follow-up care for women with breast cancer varies across the country.
Researchers at the University of California say there's not an explanation for the differences in care. So we're taking some questions right to the experts. For In Your Corner's Catherine Marsh is at Southwest Florida Breast Surgery with more. Catherine.
Good morning. Yes, we are here at Southwest Florida Breast Surgery. I've got Dr. Elizabeth Arguelles joining us all morning long. We've been speaking about this recent study that shows that there's a variation in follow-up care when it comes to women diagnosed with non-metastatic breast cancer, which means the cancer hasn't spread. Now, you've taught us a lot all morning, but to finish off the morning, I kind of want to talk about preventative measures. You know, what can people do to really try to avoid all of this?
Sure. Well, breast cancer is more common in women who are heavier. Breast cancer incidence increases as you age, okay? So young women are less likely to have breast cancer. As you age, you can do things to limit your risk by maintaining a healthy body weight, getting regular exercise, making sure you have appropriate levels of vitamin D. Even though we live in Florida, Sunshine State, most people are deficient in vitamin D, so you can talk to your doctor about whether you need supplementation. You can limit your alcohol. Everyone likes their cocktails. Make it less than an average of 1 drink per day. And then you can also minimize postmenopausal hormone use, because a lot of breast cancers are actually sensitive to the hormones, and it can make them grow faster if they occur.
And I know we've touched on it a little bit, but the differences between having a history of even cancer in general, not just breast cancer, versus not having a family history at all.
Sure, absolutely. If you have any history of cancer in your family, mom's side or dad's side, you should definitely bring it up with your doctor. It may make you at higher risk for developing breast cancer, ovarian cancer. You may need to have genetic testing. You may need to have screening done earlier. You may qualify for an MRI. So there are a lot of factors that go into that.
And it's never really is it too early to get tested or anything like that?
It's never too early to discuss it. There are recommendations for when you should start screening, but if you don't mention it to your doctor, they won't know to recommend the screening. And if there's ever a question, always ask to be referred to an expert so that you can have that conversation about whether you are at higher risk or not.
All right, so very important information. Thank you so much, Doctor.
Thank you.
Reporting in Naples, Catherine Marsh, Fox 4, In Your Corner.